The 7 months-long siege on Tigray has had a devastating impact on Tigray's health system, previously one of the best in the developing world. According to MSF, Tigray's health system had a functional referral system with health posts in villages, health centers, and hospitals in town, transporting sick patients to hospitals. Before the war, 94% of women in Tigray had access to antenatal care, with more than 70% of health facilities and about half of the ambulance funded through the community contributions. In an interview with Tigray television, Dr. Hagos Godefai said that Tigray's health system had exponentially improved.
The health system of Tigray is one of the strong health systems in the country, with a potential coverage of 95% and actual coverage of around 13 million visits every year. So the health system accounts for about total of around 1,000 health facilities, 741 health posts, 242 health centers, 39 health hospitals. When we talk about the health system of Tigray, we have to go back. Why are those health facilities established? What makes the health system strong than the other countries? In the first place, the contribution of the community in Tigray is amazing. More than 70% of our health facilities, especially the health posts, were built by the contribution of our community. So this by itself creates, by the way, awareness and ownership among our communities. So the demand is very high. So since the health facilities were like constructed by the community, they were using the health service utilization on a regular basis. The other important thing is, this is the result of the joint efforts, not only the community at large, but also the government and the non-governmental organizations as well. So this is the joint effort of three parties, like the community at large, the government, and the NGOs. By collaborating those parties, we have been like establishing a good system. And we were, by the way, visited by different African countries. In the first place, health extension program was born here in Tigray. The birthplace is here in Tigray. It was like started as a pilot basis in 2002, and it was like scale up to the country, Ethiopia, and the other African countries as well. When we take like maternal mortality before the crisis, it was like 186 per 100,000. And child mortality, under 5 child mortality was 30 per 1,000 live births. When we go back 20 years, the maternal mortality was like 1,000 and beyond. And the under 5 mortality was 167 per 1,000. So it declined from 167 to 30 per 1,000 live births. So it's about 13 million people were like visiting our health facilities in 1 year time. This is because we have introduced community health insurance. Up to 60% of the people of Tigray, especially the farmers, were benefited from the health system. They paid $50 per year, and they get service the whole year, including their families. We have about 22,000 health workforces in the system. This doesn't include Aksum and Aidar referral hospitals. So we have about 312 ambulances. And majority, almost 50% of them were like bought by the contribution of the community. So our health system is the result of, I can say, the lion's share goes to our community.
But the situation in Tigray is entirely different. According to a damage assessment by Maqala University that revealed that over 78% of health posts, 72% of health centers, and 80% of hospitals have been destroyed by the Allied forces.
It's very difficult. It's desperate, by the way, to see people dying because of hunger. It's not a big deal to treat hunger. It's about food. It's about food supply, but they don't have at hand. We are tied. Our hands are tied today.
In his article on Ethiopia's Insight, Dr. Hagos Godefai, head of Tigray's Bureau of Health, says that the Bureau had so far registered 5,421 deaths related to the siege. The deaths were recorded between July and October 2021, while the cause of death was primarily due to hunger and lack of medical supplies. The bureau head stated that deaths have continued to show an alarmingly increase, primarily due to easy preventable diseases as medicines ran out or expire. The article stated that of the 5,421, 1,500 of them had died due to malnutrition, including 369 infants. Dr. Hagos also emphasized that mortality assessments was only able to cover 333 vicinities, just 40% of Tigray, due to continued occupation of these areas by the Allied forces and lack of fuel, and said that the destruction has wiped out 20 years of progress. Dr. Hagos said that the data was collected by non-governmental organizations from their project sites in collaboration with the Health Bureau of Tigray. Lastly, Dr. Hagos said that if unfettered humanitarian assistance could not be secured, thousands more stood to lose their lives due to easily preventable diseases.